I think what most people misunderstand about obesity is how complex it really is. It's not just a child who decides they only want to eat foods that are high in calories or high in fats or sugars. It's not just you choosing not to exercise. It's very complex and it's a problem of society.
Welcome to the Afikra podcast. My name is Mikey Mhenna. Today's episode, we have Maha El Akoum, who is a manager of content and policy at Wish. Maha is based in Qatar, and this conversation is in collaboration with Qatar Foundation. And I'm really happy to have you on, Maha. Welcome.
Thanks, Becky. Thanks.
So maybe a good place to start is, what is Wish?
Yes, of course. So Wish is a community of healthcare experts from around the world who come together every 2 years in a biennial summit that attracts ministers of health, academics, people from industry, researchers from all around the world to discuss really the main global pressing healthcare issues of that year. There's three arms of Wish, like I'd like to say. One is the research and policy. So we publish over 10 reports every 2 years on different healthcare challenges. There's a policy arm as well where we work with the Ministry of Health in Qatar to implement the recommendations from these reports. And we also work with multiple international organizations as well and partners to try and get the word across and implement some of the policies abroad as well. There's a community arm to Wish where we work on the ground with the community, whether that's with awareness raising campaigns or capacity building activities within Qatar, also in collaboration with a lot of our partners, mainly Hamad Hospital, Hamad Medical Corporation, and the Ministry of Public Health. And then there's the summit, which we host every 2 years, as I said. So that's Wish for you in a nutshell.
Cool. And I should say, WISH stands for World Innovation Summit for Health.
Yes.
So if people are listening to this and want to understand more about it, you can go search that, and it's easy to find online. So today's conversation is about something that I think people in the region may know is an issue, but I don't think people outside the region understand it as being a key sort of issue, health issue, which is childhood obesity. Can you give me a sense of the state of childhood obesity in Qatar, but also, using that as an example for the region at large?
Yeah, so it's an epidemic of global proportions, we say. And there's been an alarming rise that we've been noticing over the past years, not only in Qatar, but globally. And it's not only in the EMER region or the GCC region per se. It's a global problem. Global prevalence of obesity is right now around 13%. For childhood obesity, it lies somewhere between 5 and 7% globally. In the region, it's a lot higher than that. So when we look at Qatar, for instance, it's around 27%, which is not the highest in the GCC region. Yeah, it's not the highest in the GCC region, but it's still a cause for concern. So
let me ask you a question, just like as simple as possible. Are Arab kids more obese than their counterparts in other places?
The simple answer is yes. Unfortunately, so.
Why? What is the answer?
For a number of reasons.
Let's talk about the number of reasons. What are the reasons?
So obesity is multifactorial. So there are lots of things that cause obesity, which is why the solution isn't always easy. So this can be, a lot of it is attributed to lifestyle and dietary habits, and some of it is attributed also to genetics, which doesn't really explain the sharp rise over the past few years that we've noticed. Hormones also play a role. So there's ghrelin, which sort of indicates, it tells your body when you're hungry, and there's leptin that tells your body when you're full, and those are only two out of many, many hormones responsible for obesity and weight gain. So in the region specifically, we've noticed with globalization and same all around the world, that we're now living a much more sedentary lifestyle. So we're all sitting at home, especially during COVID. I mean, COVID had a huge impact on childhood obesity. More people spending time at home, spending time on their tablets, on their laptops, on their phones, not really walking or getting out or going to the parks or being as active as they usually do. Even just the commute to schools or all of that has an impact. We also know that over the years and due to globalization also that our diets have changed. So whereas traditionally we'd have a diet that was high in fruits and vegetables, high in fruits and vegetable intake and high in healthy fibers and whole grains, now we're looking at a more calorie dense diet. We're taking in a lot more sugar, a lot more fat. So that also plays a role. Economic development plays a role. So as people get more wealthy, they have something called disposable income, which most people spend on food. And when you eat out, you're more likely to have food that is higher in fat and higher in sugar. So you're more likely to increase your calorie take the more you eat out. So there's really a bunch of things. Urban planning is also a big thing. So how we design our cities, whether we have accessible pedestrian paths, biking paths, whether the city is built in a way that encourages physical activity or not, that plays a big role. The policies in the country, we say that because obesity is multifactorial, that it's a problem that arises first because of the decisions that we make on a social level, rather than on an individual level. So a lot of the responsibility lies in what the policies are in the country, and in terms of, taxation, subsidization, the availability of foods, access, the marketing of foods, and so on. So there's so much that goes into it, and which makes the solution all the more complex.
Is there, if you look at, I want to talk a little bit about disposable income and the
Hmm.
correlation between income or wealth and
Hmm.
obesity.
Hmm.
Do we see a very significant, statistically significant correlation between those two things?
I mean, I would have to look at the statistics. I would have to look at the research around it. But yes, in general, yes, we do see a little. Generally, it was thought to be a problem of high-income countries, but we do see that that's changing, and now low-income countries are also low and middle-income countries are also experiencing this alarming rise in childhood obesity. So yes, there is a correlation, but it's not the only reason. This disposable income is not the only reason. We know that fast foods are cheaper, they're more accessible, they're marketed better. So there's a lot more that goes into it.
Can you give me a sense of like the history of this thing? Like aside from like speaking to your grandparents and grandparents saying, we used to eat differently and we weren't so
Yeah.
fat and we weren't this and we weren't
Hmm.
that.
Hmm.
When did obesity become an issue in the Gulf?
Hmm. I would say following the oil boom, when we saw this sort of heavy influence from the Western world, that had an impact on our diets and the foods that we eat, basically, and the lifestyle choices that we make, and with sort of the increased access to digitalization as well. So as I mentioned, people spend more time, especially children. I mean, I can see it with my own son, like on iPads and phones. Whereas we didn't have that back in the day. Back in the day, we were just pushed outside to go play with your friends outside in the park, go play football, go play basketball. It was never. We didn't have this to resort to. We didn't have the digital technologies.
But I mean, in countries around the world, there's iPads in Sweden, there's iPads in every single country, there are iPads in Japan, there's iPads in all these different places. Um, who has actually fought this trend, this global trend effectively?
Mhm.
Like, who's doing this right?
So in other countries, you mentioned Sweden. Well, you have to take into account the weather also in the GCC. So most people spend their times indoor probably 80% of the year, because of how hot it is during the summer months. So you have to also look at context. In Europe and London, for instance, walking to school is normal, like it's a normal thing. Walking to school, biking to school. Here, those are not things that you do here. Um, you get into your car, from your doorstep to doorstep to doorstep, you're in a car, or you're in a, you don't move around. You wouldn't go out and play in a park in Qatar during sort of June, July, whereas in Sweden or London, you could do that most of the times in the year. So you also have to look at context, the weather, the accessibility of parks and playgrounds. There are multiple things that go into it.
Okay, but fine. Like, but Sweden is cold as well, right? So
Yeah,
like there are
Sweden's cold.
places there are places where people aren't outside
Yeah,
all the time.
all the time.
But
Yeah.
it seems like the main driver would be, garbage in, garbage out. The main driver is high fat saturated foods, chips and French fries and sugary drinks, basically.
Hmm. Hmm.
What can we even do to fight
Yeah.
that? I mean, like, are you just going to be knocking candy out of kids' hands as you walk down the street? Like, what can we actually do? And where have any of these policies actually worked?
Hmm. There are a number of things that governments can do actually
Yeah.
to help to change these outcomes. In terms of advertising, for instance, in food marketing, whether it's digital or physical, sort of like banning the advertisement of junk foods on billboards within a certain radius of schools, for instance, or having what worked really well in the tobacco industry is having or banning the advertisement of junk foods, for instance, at certain times of the day, having them only late at night where children aren't typically watching TV. Food labeling works really well. So front of package labeling, where you can make it really simple. The traffic light labeling systems where you have clear color coded information on the front of the package of your food that or that you're picking out at the supermarket, and that way it's easy for children to understand, even so they can make more informed choices. You can sort of advocate for the promotion of healthier alternatives to certain foods. You can support the marketing of healthier foods. Taxation is something that has worked in certain contexts, but
Tell me
not
about
in others.
taxation. Are you just like literally like adding a lifestyle tax to these things, saying, okay, if you want to eat a bag of chips, you're going to pay 50% more than not a sort of a healthier bag of chips or a smaller bag of
Yeah.
chips? Like, what is it?
Yeah, so the taxation works on, so depending on the amount of sugar or the amount of fat in a certain food, you get taxed based on that. But it's not worked in all countries. In Denmark, for instance, it was implemented and then retracted because it took a heavy toll on sort of the so lots of people lost their jobs basically in the food production industry, and then people would just go to neighboring countries to buy from their supermarkets instead of buying from the food available in the supermarkets
Mm.
within Denmark. So there are problems associated with it. In the UK, there was a sugar sweetened beverage tax. So they increased taxes on sugar sweetened beverages, and that showed an association in a decrease in consumption within in those drinks within the 10 to 15-year-old girls, like schoolgirls between the ages of 10 to 15-year-old. So it's proven effective in some places, not very effective in others. So but all in all, I think it is something that we recommend in the report that we've written, definitely. And it is a good practice in general. You can also subsidize healthy foods, which encourages local agricultural development. You can increase public awareness through healthy eating campaigns. Lots of countries have national dietary guidelines, for example, But how are these national dietary guidelines communicated? Is there a way we can communicate them better? What kind of campaigns can we do on a national level or on a regional level to help people make better informed choices when it comes to their food, their intake?
Mm.
There's a lot of work we can do with schools as well. So there's healthy eating canteens, for instance. That's something that's worked particularly well in Qatar.
Before we get to schools, I have questions about the taxation. Because once you start including taxes, you're ascribing a monetary value
Mm,
to the problem, right? And
mhm,
you're saying, okay,
mhm,
listen, we think we are going to levy a $1 billion tax across all different manufacturing because the problem costs us 10 billion or whatever, right? So in this report that you guys are publishing or in your research, have you quantified or tried to estimate the cost of the problem? Why should anyone care that kids are obese? How much is it costing us as a society? How much is it costing us in real terms?
mhm. So we've not done that in our report. Our report is based on a desktop review of policies that are in Qatar
Yeah.
within the Ministry of Public Health. So we've not gone as far as to look at how much this is costing, but of course, this is something that we plan to do in the future. But we do know, of course, from international studies that there is a huge cost because obesity in childhood is linked with obesity in adulthood. So children who are obese are likely to turn into adults who are obese, and there are multiple comorbidities that are attached to that. So, obese adults are more likely to be diabetic, or more likely to have heart problems, are more likely to have hypertension, for instance. So, there's multiple problems associated, health problems associated with obesity.
Why is that? I'm going to like just try to target this issue. Like for somebody listening to this, it's like, okay, that's their problem. They want to be diabetic. Let them be a diabetic. They want to be obese. Let them be obese. They have the money. They want to buy some French fries. Go for it. Like sprinkle some cinnamon and sugar on it. Go for it. It's your life. Why is that a societal issue that requires societal problem solving?
It's a burden on the healthcare system, first and foremost, but also you're losing you have the quality of your life. You're losing the quality of your life. So that means you're out of work more often. You're out of school if you're young and obese and unhealthy. That impacts you in the long run with like the jobs that you're likely to get and the income that you're likely to get in the future. So it's very costly both on the government and on yourself as well. I mean, it impacts you in the long run. It's also heavily stigmatized. So people who are obese are more likely to be depressed, for instance, or more likely to have social anxiety, again, which stops them from going out, which stops them from finding certain jobs or taking on certain jobs. So it's extremely complex and it's a long-term problem. So.
I think of this stuff in terms of like societal productivity a lot. Like when you start making, national policies, it's usually associated with this costs us too much to fix this problem, so we're going to solve the problem before it starts. Like an example of that is like the famous Singapore anti-gum policy. And the reason, as I understand it, is the reason why they banned selling gum was not because it's bad for your teeth and not because they have a moral opposition to selling gum, but because it was too expensive to clean gum off the streets, right? And it was like, this is costing us too much. And so we're just going to remove this. And the industry hates it. The gum manufacturers hate this, but it just like, we just balanced it out. It's just easier to police this and to ban this than it is to clean it. And so I'm always wondering about that side of the balance sheet. Like how much is it actually costing us? Because maybe it's not actually costing us that much, in which case we're not going to go through the trouble of banning it and taxing it. So I always wonder about stuff like that. So you were talking about schools. Let's go back to schools for a second. I'm typically very weary of like I used to be a school teacher, right? So I'm very typically weary of like giving kids options, right? Because I don't think kids who are like eating, like nachos think that they're healthy. Or kids who are eating like candy, I don't think that they are like, oh, I didn't know that this is unhealthy. They're very aware that it's unhealthy. So I wonder like how much the availability is going to actually incentivize or prevent them eating sugar. Sugar is amazing. It tastes incredible, right?
Yeah, it
So,
does.
so I mean, how are we gonna to make that possible? What are the strategies? Educate me.
So we don't give them options.
Okay,
So
there you go.
basically, what's worked in Qatar is the Healthy School Canteen campaign, where they've completely banned foods that are high in sugar, high in fat. They've gone through to like mostly vegetables and fruits and whole wheat bread where possible, no deli meats. So basically not giving them options, and it's shown it does work, but it also has to go hand in hand with education. So there are lots of things that we can do around education in schools, teaching them what's healthy, what's not, and sugar content, for instance, in different kinds of foods that they eat on a daily. Once they're more informed, the hope is that they will make better choices. And there are other things that can work in a school setting as well, such as increasing the time that for PE lessons, for instance. I think in Qatar it's like once or twice a week, whereas we know that the guidelines or the recommendations by the WHO is 60 minutes per day. So maybe giving them more options of different types of sports that they can take part in. For instance, if a child decides he doesn't like football and all they're doing at school is football, give them multiple choices and things that they can take part in, so that they're likely to like something and actually participate in it. Parental involvement is also super important. So bringing in the parents and doing maybe cooking classes together. Increasingly, we're seeing more sort of kitchen ed classes and being offered as part of GCSE or A levels or the education programs at a higher level. So there are lots of things that we can do. Also making sure that there are very accessible walkways to school. So children can walk to school, they can bike to school if possible, giving them that option too. Yeah, but it requires a lot of work with parents, with the school management itself, also with the educators at school. So not only the teachers, but sort of the nurses as well, how to pick up on children who are maybe struggling or gaining weight. We know that, okay, they measure BMI on a regular here. But also making sure that when they do measure BMI, that it's done sort of discreetly so the child isn't subject to any sort of stigma or bullying. So even like ensuring that these things are done discreetly, that they're done accurately, that once they are done, so, like once we do pick up on children who have a high BMI, that what's the next steps? What do we do about it? Are they referred to a hospital? Do we inform the parents that we don't just take in this data and do nothing with it? So yeah, you need to take sort of a very wide angle approach to this.
Yeah. I was thinking about this percentage, this 27%. Is there, if you look at it by sector, by community, are there interesting trends? Is it like 60% of Qatari children and 10% of foreign domestic worker children? Are there different categories, income brackets, different professions that have different things? Or is it 27% across the board?
No, I'm sure there is, but based on one of the comparative retrospective studies that took place between the years 2016 and 2019, I think, we see that it's rising more sharply within the Qatari community rather than the expat community, and it's rising more sharply among boys rather than girls. So these are the trends that we're witnessing. I'm sure there will have been studies with based on income levels, but I haven't seen that data yet.
Yeah.
But yeah, these are the trends that we're witnessing so far.
Do you think that is your hunch that the 27% is trending upwards or downwards?
Upwards for sure. So over those 3 years, it's increased by 3%, so around 1% a year.
Wow.
COVID didn't help for sure, so we're probably looking at higher rates right now. That 27% is from 2019.
Interesting. You mentioned tobacco. Okay. Tobacco is interesting. I mean, I was born in the 80s. When I went to school, for better or worse, not for better, for worse, so many of my friends in high school and when they went into college smoked cigarettes. I grew up in Lebanon, high percentages of kids who smoke cigarettes. Um, Now, because of very effective campaigns, um, so many people are like shamed if
Yeah,
they smoke cigarettes. There's like
yeah.
proper shaming, especially in the States. And if you light a cigarette in the States, you're like you are you're like a leper, right? You're completely shamed. People look down on you. They really judge you harshly. Um, for some reason, I feel like that with obesity, you can't do it the same way, right? You can't do it the same way because oftentimes when somebody is obese, they think it is a reflection of who they are and not the decisions that they're making, right? So how can you strike that balance? Because the shame is so effective. I think that that's a huge part of the reason why we've seen incidents of smoking plummet.
Hmm. Hmm. No, definitely. I mean, what we've seen from the tobacco industry is amazing in terms of impact. The front of package photos that you see, the warning labels, the banning of tobacco in schools and universities, in public restaurants, for instance. It's come a long way, but you can't do the same with obesity. There's a huge stigma associated with it already. So imagine adding to that. So it becomes a lot more complex. And it is already complex the way things are because some people are predisposed based on their genetic makeup. So it's very tricky. Whereas smoking is a lifestyle choice only. You're not predisposed to you may be predisposed to addictive behaviors, but not predisposed specifically to smoking. So it's not the same. We're not comparing oranges to oranges, definitely.
Yeah. Are there any, if we look across the Arab world more broadly, obviously your study focuses on Qatar, but I'm sure you're part of a community of researchers globally. Um, are there any examples, literally anywhere, whether it's in Latin America or South Asia or Africa or wherever, where we've seen incidents of a quarter of kids being obese and then effective policy to bring that number down to global averages?
Not
I don't
yet.
even know what. Yeah.
Not yet. No. It's something that we're working towards, definitely. And the WHO has some goals of at least not increasing the rates or the prevalence of childhood obesity by 2025. So we reach a stage where they're not increasing. But no, we've not seen that anywhere in the world yet.
You used the word epidemic earlier.
Mm,
Epidemic is like a really intense
yeah,
word.
it is. Yeah.
Do you feel comfortable that it's warranted? Because epidemics require serious, drastic action.
Either accesses the healthcare system, either so children won't get picked up until someone actually goes to the hospital with a problem, with a medical problem.
Yeah.
Or you're in a school that actually records this data and sends it to the Ministry of Public Health. So
Yeah.
it's probably a much larger number than what we're actually seeing today. So yes, I definitely epidemic proportions. Our report looks at 6 levels of policy intervention. So we're looking at food and nutrition, and some of the things that we mentioned that we've talked about are taxation and subsidization, food labeling, food marketing, product placement within supermarkets, for instance, how these products are marketed, all of that. It also looks at the family and community. So, how civil society organizations, for instance, can work with the government to implement certain policies or to do awareness campaigns around childhood obesity. and how we can use sort of members from the public to act as advocates for childhood obesity, which is something that has been effective in other contexts. We look at the school setting, and we spoke about healthy school canteens and the banning of junk food in schools and the sale of junk food around the school premises, the advertising of junk food around school premises, and so on, as well as physical activities, as well as the education of the staff at the school, whether that be teachers or nurse practitioners or counselors at the schools, and the involvement of parents through educational activities around healthy eating in a school setting. We look at clinical guidelines. So there are international clinical guidelines, but also national clinical guidelines on how to handle obesity within every country, even looking at things such as bariatric surgery at a last resort and how these things are controlled and managed. We also look at the first 1,000 days. So the first 2 years of life are extremely important. We know that women who have gestational diabetes, for example, which is extremely common in this area of the world, are likely to have children who grow up to be obese. And there are certain things that we can do about that. The main thing is increasing breastfeeding. I think the statistics are from an unpublished study in Qatar that around 24% of women in the country continue to breastfeed after 6 months. So looking at how we can increase those practices, make it so that it's easier for women to breastfeed for longer times, whether that means increasing maternity leaves or having a certain amount of lactation consultants, for instance, within hospitals per patient, for example. So there's a lot of things that we can do within the first 2 years of life around education and around breastfeeding in particular. There's also urban planning and urban layout, urban development. So looking at making more accessible walkways, more accessible crosswalks, for instance. So it's not only important that you have somewhere to walk, but that it's also that you get to where you're going to. You're able to get to where you're going to without any complications. So safe crosswalks, having sort of accessible green spaces. There's a Qatar Open Spaces guidelines that was recently published that sort of mandates one park per residential area, which is great. So that's a start to things, and we're seeing those being built up within the recent years. So yeah, there's so many things that can be done. We've mentioned food and nutrition, school settings, community and family, first 1,000 days, clinical practices, and urban design. So those are the 6 levels that we speak about mainly in the report.
So the idea of it being sort of this multifactorial issue that requires a multifactorial solution, and you just outlined all the different factors and this multi-pronged approach. My inclination is to believe that not the soul, but the main factor is clearly the food, right? That if you were only to attack one issue, one of the factors, that the overwhelming dominant problem is the food people eat. Green parks are good, crosswalks are great, people need to walk around, people need to exercise, 1 hour of PE sounds excellent. Like all these things are all nice to haves. It seems like the only must have is we need to fix the food that people eat.
Mm-hmm.
Would
But
you agree?
even within the food, it's not just the problem of or the issue of the Ministry of Public Health. You're looking at, for instance, marketing or taxation. You're looking at the Ministry of Commerce and Industry, for instance. You're looking at marketing. You're looking at I don't know, food labeling. That's also a different sector. So it's even within food, it's multi-sectorial. You can't, there's no running from it. So it's everyone's responsibility, and health should be across all policies, not just the problem of the Ministry of Public Health.
Okay. Let's say everybody agrees, right?
Yeah.
Everyone says, we don't want obese kids. No, we understand it. maybe we don't know exactly how much it costs us, but we realize that there's a problem. Like, I don't think anyone shakes their head, right? Like if you're speaking to a room of, 100,000 people and you say, this is a huge problem. A third of, between a fourth to a third of kids in this country are obese. This is a real problem. I feel like everyone nods their head. Everyone says, yes, we agree. And you say, we need to fix it. Everyone nods their head. We need to fix it. And you say, we've thought about this. And these are the ways that we think we can fix it. Everyone nods their head, right? Why isn't it being fixed?
Mhm. It's always difficult when you'll only see impact in the long run. So
Okay.
it's not a quick buy. It's not something that you'll implement tomorrow that'll have an effect tomorrow. It's something that you'll um, see impact from in for years to come, 10 years, 20 years down the line. It's going to take time.
What is at, what is, why is this problem not being solved? Why is no one confident that this problem will actually be solved and no longer be an epidemic?
It'll only be solved if everyone does their part.
Mm.
And until everyone does their part, we're gonna keep going. It's just gonna keep getting worse, basically. And each one of the solutions that we've outlined in our report, our contribution to the solution, not the, sorry, our contribution to the solution, not the solution itself. So unless everybody is 100% committed, which is why we're having reports like these, which is why the launch of this report will be essentially bringing together all ministers from all different sectors in Qatar, and asking them to commit to these policies. Within our report, at the very end, we've actually assigned sectors different policies. So encouraging them to take accountability for these things. So unless they all come together and everybody does their bit, there's one sector doing some one of the or implementing one of the policies isn't going to make the difference. It's everybody coming together to do it.
Mm. From a like a regional and global competitive standpoint, how does this actually increase the competitiveness of an economy? Because I feel like that's a pretty strong motivator.
So when you implement, for instance, taxes,
Yeah.
and you're saying the less sugar you have in your foods, the less tax you have to pay, so the cheaper the product is. Then you think for manufacturers, for instance, can get creative with how they compete to have the healthier option that's the cheapest option available in the market. So one of these things can be looking at how you incentivize the manufacturer to actually produce foods that are lower in salt, that are lower in sugar and fat, for instance.
Cool. Okay. Before we end, I want to ask you, what do you think people like me misunderstand about this problem? And how do you think that misunderstanding is contributing unintentionally to the growing problem?
I think what most people misunderstand about obesity is how complex it really is. It's not just a child who decides they only want to eat foods that are high in calories or high in fats or sugars. It's not just you choosing not to exercise 60 minutes per day, for instance. It's very complex and it's a problem of society. There's a lot of studies going on around how we can tackle this from behavioral insights, how we can use nudges to change the environment so that the healthier option is the default option, for instance. So it's not only the responsibility of the child. It's not only the choice of the child. It's the choices we make as societies. It's the policies that we have in the country. It's the policies that are implemented in schools, for instance. So it's not just you cannot sort of point fingers or give blame to just the person who is obese. It's very complex, very multifactorial, and sometimes it's based on biology, for instance. So it's you need to approach it in a way that's extremely sensitive, and very encompassing and multisectorial.
Interesting.
Yeah.
Okay, so what comes next? The report comes out, then what comes
Yeah.
next?
as I mentioned, we're bringing together all of the ministers from the different sectors in Qatar to help sort of, first of all, present the report, but also present the solutions outlined in the report and helping them to sort of take accountabilities for certain policies that we can implement. We're looking at using Education City as a pilot program. I don't know if you've ever been to Education
Yeah.
City, but it's a city within a city. So there's universities, there's grocery stores, there's student accommodation. So basically looking at sort of the low-hanging fruit that can be done within the short term, within the first few months, and then planning on the long term, sort of more impact on a national scale. So working with the different ministries to implement sort of labeling as a priority, maybe looking at how we can expand the taxes on sugar sweetened beverages to encompass other unhealthy foods as well. So there's two bits to it. There's first looking at what can be done quickly that can have some good impact, and then looking at what can be done in the long term with the sort of buy-in from all of the different government sectors.
And in a report like this, when you issue all these prescriptions and these recommendations, is there like a timeline that you also submit saying, if we do this, this is what we expect to see? This is how we're sort of trying to bring down the number?
So yes, we always base everything on what's been done in other countries, international best practices. So yes, we do say that there's no data to start with. So in the very beginning, we have to collect data to see where we're at, the status quo, the baseline. And then say we implement the intervention or the policies that we recommend in the report, and then sort of make it a point to measure the impacts, so have all of our very measurable outcomes. So yeah, definitely it's something that we plan to do. There's no data to begin with, so that would be a start. And then sort of look at it from now until 5 years and the impact these policies have had in that time.
Okay. The last question I'm going to ask you before we wrap up is recommendations for our listeners. So somebody listening to this who's interested in learning more about childhood obesity and some of these best practices, are there any books or movies or documentaries or things that you think people should go check out that would be a good place to start for understanding this issue?
I would always refer everybody to the WHO sort of reports and guidelines on the issues as a standard. I would recommend for you to read our report, which will be made publicly accessible as well next year. I'm sure there are many documentaries. I can't recommend one, but many documentaries on like food manufacturing and the food industry that are extremely informative. So yeah, but WHO definitely is a starter. Looking at your own national dietary standards and guidelines is also very important, just as background information as well.
So interesting. So where can people find this report when it comes out?
It'll be available on the WISH website as well as the Ministry of Public Health website.
Amazing. And if people want to find you, they can find you online, Maha _El Akoum, AKOUM. Maha, this has been really fun. I really appreciate it. It's an issue I care about a lot, and so I'm glad that we're able to talk about it and talk about possible solutions. So thanks so much.
Thank you.